Surgery for sciatica. Is it really the only option that will actually work? Because if you have been living with that shooting, burning pain down your leg and someone has pointed you toward an operating table, you need to watch this before you make any decisions. The truth is, most sciatica patients are never told about the non-surgical treatments that are producing real, lasting results, not temporary relief, not just pain management, actual recovery. And that is exactly what we are covering today. Hi, I am Dr. Megan Tomberlin, a chiropractor at Waves of Wellness Chiropractic in Leland, North Carolina, and I want to be straightforward with you. Surgery is sometimes presented as the logical next step for sciatica, especially when the pain has been going on for a while or when it feels severe enough to be disabling. But for the vast majority of people, there are real, proven, non-surgical options that go well beyond just managing symptoms, options that address the actual source of the problem. And a lot of people simply never get told that. If this is helpful to you, please like this video and subscribe. We share honest health content for people right here in the Leland and Wilmington area, and we would love to keep showing up in your feed. So before we talk about solutions, let me make sure we are on the same page about what is actually happening in your body. Your sciatic nerve is the longest nerve you have. It starts in your lower spine, travels through your hips and glutes, and runs all the way down each leg. When something compresses or irritates that nerve, whether it is a herniated disc, a bone spur, or a tight muscle, the result is that unmistakable combination of burning, shooting, electric pain that can travel from your back all the way to your foot. For some people, it is constant. For others, it flares unpredictably. Either way, it takes over your life. Here is what matters most. Sciatica is a symptom. Something specific is causing that nerve to be irritated, and until you address that cause directly, the pain keeps coming back. That is why the approach we take at Waves of Wellness starts with figuring out exactly what is driving your sciatica, and then matching the right treatment to that cause. Let me walk you through the 3 treatments we use most often with sciatica patients. The first is spinal decompression. If a herniated or bulging disc is pushing against your sciatic nerve root, decompression is one of the most effective tools we have. It uses a specialized table to apply a gentle, controlled traction force that creates negative pressure inside the disc. That negative pressure encourages the disc material to pull back away from the nerve while also drawing in the water, oxygen, and nutrients the disc needs to actually heal. Patients are usually surprised by how relaxing it feels. No incisions, no needles, no downtime. Just a gradual process that gives the disc a real chance to recover. Over a series of sessions, many of our patients see dramatic reductions in leg pain because we are treating the compression directly rather than just quieting the nerve signal. The second treatment is active release technique, and this one is important to understand because not all sciatica comes from a disc. A significant number of people have what is called piriformis syndrome, where a muscle deep in the glutes is the real culprit. The piriformis sits right next to, or in some people directly around, the sciatic nerve. When it becomes tight, overworked, or develops adhesions from too much sitting or repetitive movement, it can grip the nerve and create every symptom you would associate with a disc problem. People spend years treating the wrong thing. Dr. Jordan on our team is certified in active release technique, which is specifically designed to break up those adhesions and restore normal tissue movement. By applying precise tension while guiding the joint through a range of motion, ART releases that grip and frees the nerve. Some patients feel a meaningful difference after just a few sessions. The third treatment is dry needling, and this is one I work with closely in my own practice. If the word needling makes you hesitant, let me explain what is actually happening. Dry needling targets trigger points, which are tight knotted areas inside a muscle that create pain both at the site and in referred patterns further away. In sciatica patients, trigger points in the lower back, hips, and glutes frequently refer pain directly down the leg in a pattern that closely mirrors the sciatic nerve path. Some patients have been told for months that they have sciatica when a significant portion of what they are feeling is actually referred muscular pain. The needle enters the trigger point and causes a brief involuntary twitch, which is the muscle releasing. Blood flow returns, the knot dissolves, and that referred pain pattern begins to quiet. Combined with chiropractic adjustments and the other treatments we discussed, dry needling can make a real difference in how quickly people recover. Now, the question I hear most often at this point is, how do I know which one is right for me? The honest answer is that most sciatica patients benefit from more than one of these approaches, because the body rarely develops one single isolated problem. You might have a disc creating the original compression and a tight piriformis that developed in response, plus trigger points that have built up from months of guarding and compensating around the pain. We do a thorough evaluation, listen to your full history, and build a plan around what your body actually needs rather than a generic protocol. And to come back to where we started, surgery is sometimes the right answer. There are situations where it is necessary. But the evidence is clear that conservative care should be fully explored first. Many people who commit to a structured non-surgical treatment plan recover fully and never need surgery at all. That is not wishful thinking. That is what the research shows, and it is what we see in our office regularly. If you are in Leland, Wilmington, Brunswick County, or anywhere in the surrounding area and you are living with sciatica, or if you have a surgery recommendation on the table and you want to understand your options before you decide, please reach out to us. Call us at 910-859-8359 to schedule your first appointment. We will sit down with you, do a real evaluation, and give you an honest picture of what we think is going on and what we believe will actually help. You can also visit us at wavesofwellnesschiro.com or come see us in person at 473 Old Waterford Way, Suite 118, right here in Leland.